So complications that can happen after a heart attack that we don't always talk about. And actually, probably it's not everyone that knows about this. So as I said in the last videos, I'm going to make 5 videos on this. The first one that I'm going to start with, I just want to say this is not to scare you. This is just to give you the information that it can happen, but it's very rare that it does. But I still think that it's necessity to know about this because you never know what can happen in the future, all right? When someone has a heart attack, part of the muscle loses oxygen because of a blocked artery. And if that area becomes very weak, especially in days after the attack, it can actually tear or rupture. So the name for this is a ventricular wall rupture. And it's one of the most serious complications of a heart attack. It usually happens within the first week that a heart attack happened. And most often between day 3 and day 7. This is when the heart muscle is soft and actually healing from the heart attack and from the lack of oxygen. So the signs of this, they do come on suddenly, and it's things like collapse or severe chest pain, shortness of breath, or even sometimes shock. Unfortunately, if it does ever happen, very often it will be fatal because if it's not treated immediately, it's very hard to recuperate from. But now, after a heart attack, if someone had a CABG, which is CABG for coronary artery bypass grafting. So this is when you go through surgery and they do a little bypass to bring the oxygen to the part of the muscle of your heart that was lacking oxygen. The risk of a heart wall rupture is usually much lower. And that's because the surgery restores the blood flow to the damaged areas, preventing more heart muscle from dying. However, if the rupture was already forming before surgery, or if part of the heart muscle was severely weakened, there can still be a small risk, especially in the first week or 2 after the heart attack and the surgery happened. This is one of the reasons why doctors watch patients very closely after a heart attack. Those early days are critical. So if you've had a heart attack and you feel new or worsening pain, breathlessness, or even feel dizzy, please do not ignore it. You need to get help right away because this can actually save your life. So for all of those that would like to have more information about the heart attack symptoms or the coronary block, I do have in my stand store, I do have PDFs that you can download and get the information. So I know you've got this. Until the next one, Dolu.